Yes. Did you hear that?
Yep.
There we go. Same thing on this side. There we go. So what brings you to clinic today?
I've been having pain for the last year and a half on my right foot.
Where exactly has been your pain?
It has been on the bottom, right
Okay.
here in the middle,
Okay.
and also this top part right over here.
So you have a pain right about here in this bottom part, and then you also have a pain on this top part.
Right, yeah.
So have you always had a pain in these two areas before?
No, that's just been the last year and a half.
Okay, I see.
Never had pain before that.
Okay. Did you have any injuries or accidents to your foot?
No.
Okay, so you have a pain about right on this area.
Yes.
So when I push down right here, do you have any pain?
No. It's more on the middle.
In the middle side, right here.
Yes.
Right about is where you have pain. It's already giving you a lot of pain here like this. When you have your foot up here like this, does that give you pain?
No.
So when do you have the more pain? Do you have pain when you are walking a few steps in the morning, or do you have a more pain in the nighttime? When do you have pain?
More in the morning.
More in the morning.
When it shows up.
Okay. Do you have any pains in your ankle?
No, not at all.
Okay. All right, so I'm going to go ahead and then do some more tests on you. So you are going to tell me exactly what you feel, and then you're going to tell me, if there's any motion that hurts, and then I'm going to go ahead and examine your foot from here to here. Okay.
Sure.
So go ahead and push out, please. Do you notice that you're pushing it?
With the right side.
Yeah, you see, notice that this, like, you are resisting pretty good with this one, but you are actually having a lot of flappiness. I'm putting same amount of pressures. You are trying to put a lot of pressure, but you see there's a lot of weakness on this side.
Yeah.
This tells me that you have a problem around this area. Do you understand what I'm trying to say?
Yes.
All right, go ahead and push down, please. So that's pretty equal. You're pushing very hard. Please don't break my thumb. That's fine. Okay, with this back of the heel, you're going to press down. It's almost equal, but you notice that I'm able to move my hand a lot more on this side. So what tells me is that you have weakness in the side of the foot on the outside, and then you also have a weakness in the back of the heel, the Achilles tendon in this area, where you might be having problems.
Okay.
And I'll tell you why this might be significant. Okay, go ahead and then press up, please. So up is almost the same, but you notice that you are able to put this a lot higher here as opposed to here, not so much. Do you notice the difference?
Yes.
Okay. I'm going to now go ahead and test the individual strength of your toes. Go ahead and push down with the pinky toe. Push down. You are pushing it down?
Yeah.
This one is actually, I can see you're pushing down, but I don't feel anything you're pushing down here.
Like I'm really struggling with that.
Struggling, yeah.
Yeah.
Press down over here. Okay. Press down with over here. So I can see that you are pressing pretty well with this one, but with your left side, you are not actually pressing so well with this one. Do you notice the difference?
Yeah.
How about on this side? Press down. You are pressing pretty well on this side, but here, once again, it's kind of flopping. Press down with the big toe. That's pretty much equal. So this is actually the worst one. Go ahead and press down with the pinky toe. You're pressing down with this one, but here I can move it like all day long.
Yeah.
Okay. How about press outside with the pinky toe? You're pressing it with this one. Press. You are?
Yeah. I'm actually moving.
Okay. This is weak. Press. This is the side of the foot right here, right on this area. Go ahead and press out, please. Weaker on this side. Do you notice the differences?
Yeah. This is more stern, and this is very shaky.
Do you know what that means? So it means that whatever problem you might be having is not a couple months. This is actually, you could have problems here. You might be feeling it now. The problem has been building up for you to have pain here for many, many, many months, more than a couple months that you've been having pain here. Does that make sense?
Yeah.
Okay. So I'm going to go ahead and examine your low back, because your low back has a lot to do with your foot. So I'm going to first check for the temperature of your low back. I see this side is slightly more swollen. I'm going to go ahead and put up a scope. It's called nervous scope. It tells me any kind of deep heat inflammation, suggesting a kind of pinched nerve around your spine.
Okay.
Therapeutic, right?
Yeah.
Small thing that's rolling around. So this is where I found the problem. This is your sacral area.
Yeah.
I'm going to go ahead and push down here. You let me know if I have pain.
Yeah.
Pain, a lot of pain here, right?
Yeah.
Yeah, this is one of the contributory things. You feel this?
Mm-hmm.
So sometimes your leg and then your thigh and your knee problem can contribute to your foot pain. I'm going to be now examining your legs and your thighs, okay?
Okay.
Okay. I'm going to check for the muscles. Oh, it's already tight here. Do you notice this?
Yeah, I feel that.
So if you have tightness in the back of the leg and also back of your thigh, this also has a lot to do with you getting a lot of tightness in this area. So if you have a tightness around this here, it's always connected to tightness in your leg and your thigh.
Okay.
So I can do all the problem solvings here in your low back, but if I do not take care of your tightness in the back of your thighs, back of your leg, I will not be able to get your problem solved as fast. Does that make sense to you?
Yes.
If I have your thigh muscles and your leg muscles to be stretched properly, it gives more breathing room for your foot to function better. So if you have a lot of tightness in this area, this actually really helps. Gives you a lot more leverage. So just want to be able to show you your x-rays. And I'll be able to do my best to be able to show you exactly where your foot problem comes from. Now you might be wondering why I am showing your spinal x-ray for your foot pain, but rest assured everything in your body is connected and well. So I want to be able to show you this left side right here signifies that this is a left side. This is your spine. As you can see, this is taken from the front. This is your pelvis area. This is your leg, and then this is your low back. And then this, my friend, is taken from the side. So if I look at you from the sideways, this is exactly what you look like. So as I was, palpating and examining your low back area, you felt tenderness, point tenderness, right?
Mm-hmm.
Exactly where was that?
Lower back.
It was actually lower than the lower back. It was in
Sacral.
this area. It was the sacral area right here.
Sacral area.
Exactly where I found the problem was exactly right here, the sacral area. So sacral area looks like this. Okay, this is actually a quite common area where people have pains or problems if they have a pain with walkings or problems walking, or if they have foot pain. This is really commonly one of the most commonly affected areas of the spine that affects your foot and ankle health. In your case, it was this bone right here, the sacral second tubercle. So sacrum, as you can see, is one complete fused bone. But sometimes if there's any kind of traumas, you've been sitting for too long, like all of us do, sometimes it doesn't really help us to get this bone to be fused completely. There's a little bit of minor movements that can actually knock this one out, knock that one out, knock this one out. So that's also very much possible, and that happens in a lot of people. In your case, I actually felt some movements and the pain around this bone right here. And that actually is one of the contributory causes for you having numbness or weakness in the side of your foot.
When I was very young, about 10 years old, I was picked up and slammed in school, and I landed directly right on my tailbone.
So that's exactly what I mean. So when you have those kind of things, like you just told me, thank you very much for sharing. When you have those kind of injuries to this tailbone area right here, it doesn't fuse, or when it fuses with a micro or minor movements. In your case, the minor movements is enough to give you problems where you're experiencing. So I'll get to you exactly the reasons why you're having pain right here and right here. But right now I want to be able to address the questions why you're having such a weakness in this area and this area, also in this area. So quick questions to you. Where do you think that it controls the nerves that on this area and this area?
I'll say this on the spine.
Yes. Technically, it's not necessarily on this bone right here, but this region right here, if there's a dysfunction or lack of function in this area, it can definitely get a weakness in this area, as well as at the back of the heel and the side of the foot, and also in the pinky toe. So this has a lot to do with the foot and ankle health. So by me taking care of this area right here, I'll be able to restore the proper nerve functions of the foot. So I'll be able to get your foot to be more normalized than before. Does it make sense to you?
Yes.
Thank you. So I want to be able to show you what this actually signifies. So this is the foot. If I take away the skin, bones and nerves and blood vessels and take everything out, this is exactly what your foot looks like. Actually, no. Leave the bones inside. So this is what your bones look. You know what I'm trying to say.
Yeah.
So this is your foot looked from the sideways, and voila, it's actually the same thing. Yeah, that's exactly what it looks like. So where you are having pain is actually around this area,
Right.
and you also have a pain around this area.
Right.
So let me tell you what this means. So there's a couple things that I actually have to tell you about your right foot. Well, how you can have a misalignment on your spine here like this, and then they can give you problems. You can also have the same thing. And then by that I mean if your bones right here can be misaligned, it can certainly give you a lot of problems and give you pains where you shouldn't have pain. So problems right here where you're having pain, I can already see why that's being caused. You see this bone right here? It's called talus. This is the bone that is as close as you get when it comes to ankle.
To the ankle.
Exactly. This one is not supposed to be propped up here like this, propped up this way, and then cause this problem right here. So you see, okay, all the foot joints are supposed to be unison even. Is yours like that?
No, it looks like separate.
So look at this.
Like it's
Look at this. Your talus bone right here, and this is called navicular. This is the bone right here, as you can see. You see how there's almost like a this kind of a V shape?
Yeah.
It tells me that this bone is actually not in the right place. In fact, this bone right here has gone upward here like this. This is the reason why there are shapes here like this. This is misaligned. Not the only reasons why you're having foot pain, but please do understand that foot pain is a multifactorial, which means there are more than one reasons why. Same thing over here. This one, is this everything normal and even? Not really, but if you look at it, there are more spaces in this area than this space.
Right.
What does that mean? It has went downward and then giving you more spaces in this area and then less spaces over here.
Exactly like the top one. You said it moved and this moved, so it gives the space.
Exactly.
Opening. Looks like an opening.
And then also this bone is called cuboid, which is also this bone. Is it in the right spot? No, because this one actually went this way. I know it's kind of difficult, at least for this one, but you believe me when I say it, I mean, you have to kind of look at it in 3D fashion, but this actually have rotated this way and they're propped up slightly. This is the reason why you're able to see so much of joint spaces in this area, not so much on this side, because it has rotated and it went up all upwards slightly. So I'm telling you all this is because I'm telling you your foot is not moving biomechanically properly. Which means that any of these bones not misaligned over here can give you more problems in this area and can give you more necessary, it can give you a lot more restrictions in the joint movement, so you're not able to use your foot properly. So if something happens, it's like a wildfire. So it's like putting a lot of like dry haystacks,
Right.
and then you're playing with matches.
It will spread.
It spread very quick. So that's exactly what I mean. So this, my friend, doesn't happen in a couple of months. I can definitely tell you all the things that I just have shown to you is more than a couple of years. I would say it's more than 5, 6, even more than 10 years. So this is something that chronic that we're dealing with. So I want to be able to understand exactly what this means.
Okay.
Along with that, another thing that I have to tell you is your foot problems here is 3-dimension, but also same time, also something that I have to take account for. So your foot right here if I can actually show you with a foot model, your this bone has been made this way. That's why there's a more gap over here. Yes, and then there's a little bit more high arch. I see the high arch on this side, and this, my friend, right here, this high arch, the thing that I see right here, is where you have pain. And of course, because you have such a high arch in the rotation of this bone right here, guess what? If this bone is misaligned and is sitting in the wrong position for all the time, it gets wrong contact. Yes.
Yes.
So when you get a wrong contact, do you irritate the nerve and muscles that underneath here? Yes? Mm-hmm. That's exactly where you have problem. So what I'm going to do today with you is I'm going to go ahead, take care of nerve pressures on your sacral area. I'll also make sure that I stretch all the muscles in your legs and your thighs, the back of the thighs and back of the leg. I said was very important. Mm-hmm. I'm also going to take care of these problems right here. On top of it, afterwards, I'm going to go ahead and get a biomechanical scan of your walking pattern, and I'm going to make an orthotic. Right here, right?
Yeah.
Yep. I'm going to go and track you. You're not going to fall. You don't have to worry. There we go.
Oh, man.
Okay, go up just a little bit. Okay. Now we get to the fun part, your right foot. Yes, did you hear that?
Yep.
Same thing on this side. There we go. There we go. Metatarsal was slightly out.
Oh man.
I know everything's out.
I felt that.
You felt that?
Yeah, I felt pain.
Yeah. Just a little more. There we go. Okay. Okay, I'm going to go ahead and stretch your legs. I have to stretch both of your legs to make sure that it's going to be nice and loose. You feel it?
Yeah.
And usually, non-problematic legs are even tighter than the problem side. And you know why? Because you're using the non-problem side more. You're abusing it more. And as a compensation, it becomes more rigid because you're
The crutch.
Yeah, because you're using it more. Does that make sense?
Right.
Take a look and see how it feels. What's different?
It's a little bit better. It's a little bit loose.
How much of a so quantify the looseness? How much better would you say it is?
I'll give it a 7 out of 10.
So 30% improvement. Is that what you're trying to tell me?
Yes. Yes.
Okay, that's a good start for one visit. Like I said, this is a chronic problem. I'm not expecting any miracles after a first visit like this.
And it's just the adjustment, the bottom.
Yeah.
It's just a little bit more flexible as I bend my toes.
All right, so I'm going to go ahead and then do the test like we have done before. So I'm going to test all the muscles that we have done. So like I said, it's good that you feel 30% better with walking, but like I said, walking is a combination, a whole different kind of things. Your leg muscles, your low back, and all the other things. So 30% better is actually quite great considering that this is a problem that I've tackled that has been chronic for a few years at least. So, but nerve function is more immediate, which means that if I took care of your problems properly, you'll be able to see muscle nerve improvement more rapidly. So this will be able to tell me if your muscles are, if your muscle strength and your nerve strengths are similar than before or better than before, it tells me you're on the right track. Does that make sense to you? All right, so let's go ahead and ask you to push up. Better on this side. Do you notice the difference? Yeah. Push down, but this was already good before. Now for the big doozer, push out. Wow. Mm-hmm. Wow. I'm at loss. I'm happy. Okay, big toe first. Big toe was always good, so this is still good. Second toe, better. Not same, but better. Yeah. Do you notice the difference?
Yeah, slight.
Better. No, you're pushing it down to my left finger, so my finger's about to break. So feels good, right?
Yeah.
Do it this side. Better. Much better. This one was the weakest, right? Do you remember that?
Okay, yeah. Right.
Yeah, push down, please. Wow. Wow, do you notice the difference?
Yeah. I couldn't even do that before.
You couldn't do that. Push out. You couldn't do this before. Now look at you. This side of the, you couldn't do that last time as well, right?
No.
Push out. Almost even. Do you notice the difference?
Yes.
Do you understand the importance of taking care of your low back problem for your foot?
Yes.
Now do you understand that? Push down, please. So, one area that I've adjusted on your sacral area is responsible for this part. So once I restore the proper nerve function, now you're on the right track. Now, you told me that you've been having a lot of pain after I have done the, you told me you had a lot of pain on these areas, yes?
Yes.
I cannot change your foot type because you're semi-rigid, but I can give you guys, I can give you more breathing room for your foot to function. So if I go here like this, less pain?
Yeah.
Less pain?
Yeah.
Because when I did it before, you told me there's a sharp shooting pain, yes? How's it now?
Much better.
So much better because I have to let you know your tight muscles on your back of the leg and back of the thighs will give you less breathing room on this side. So if you are able to stretch those two muscles nicely, you will get better. Okay. So it's one thing that you must do at home by yourself to be able to get it better. It's something you can help me with to get yourself right on track. This bone right here is where you had pain because you have a cavus or high arch foot. Like I said, this one has to be done properly with wearing the right shoes. But even then, do you feel the difference on this side?
Yeah.
What's the difference about this side?
This side is not as high.
Yes.
It doesn't feel that much pain.
And then when I touch it, it's not as painful, right?
It's painful.
Because I restored the proper nerve function. Does it make sense?
Yes.
Okay. So that's it. So